You know, while some nurses are being pushed to extremes, others are being sent home, furloughed by hospitals all across Ohio. 5 on your side, Chief Investigator Ron Regan is with us now. Ron, what does this mean for patients?
Well, nurses are growing increasingly concerned that when a coronavirus surge hits, hospitals may not be ready.
These are nurses on the front lines, but others are being furloughed and watching from the sidelines. Deborah Arms heads up the Ohio Nursing Association.
What's happening is for the most part, you're seeing nurses in outpatient areas, in the recovery room, in the surgical centers. Those are the people who most definitely are being furloughed.
Hospitals are stopping elective surgeries in compliance with state health department orders, a move drastically cutting into profits. John Palmer is with the Ohio Hospital Association.
We're estimating $1.27 billion impact to hospitals. A lot of that's attributed to the suspension of those non-essential elective surgeries and procedures that went into effect in Ohio on March 18th.
A financial hit that's causing nurses to be sent home, while raising concerns about staffing if a COVID-19 surge hits.
It's imperative that the hospitals are planning now for making sure those furloughed nurses are trained so that when that surge hits, they can call them back and immediately the nurses that are still working have the help they need.
The Hospital Association says it's committed to providing appropriate training and says furloughs helped conserve vital masks, gloves, and respirators.
It's a matter of right-sizing the ship. Any organization that sees a decrease, and in our case, a dramatic decrease in revenues, meaning financial support that came through those elective and non-essential surgeries that were canceled. You have to balance that.
And here in Cleveland, St. Vincent Charity Hospital tells me that it has begun furloughing nurses, but UH, the clinic, and Metro say they have not so far. Rob.
Interesting stuff, Ron. So we know a survey of nurses is underway right now. Do we know what that shows so far?
Well, it's early, Rob, so far, but of 300 nurses that have responded, 70% of them say that furloughs and layoffs have played a part.